Good morning. Thank you, Dr. Veith, for including this topic on the program. It's been fascinating for me to research. These are my disclosures. I am employed by Allina Health, which is the largest provider of health care in the state of Minnesota. The changing healthcare environment has created what I believe is a perilous imbalance. There's concentration of power within hospitals. Hospitals with a complicit government have driven physicians towards employment and out of private practice. There are hospital-lobbied provisions in the ACA that prohibit expansion of physician-owned hospitals. There's a change in Medicare reimbursement that favors employed physicians. And the Stark laws have increasingly prevented physicians in private practice from performing diagnostic studies in their own offices. Hospitals have accumulated cash to acquire private practices. In our institution, physicians are often referred to as healthcare providers, and many administrators consider physicians as cost centers. Managed care is increasingly concerned with managing doctors. Traditionally, physicians have practiced in small groups or alone, which have made them difficult to regulate and monitor. A generational change, however, has suggested a willingness of younger physicians to trade income for quality of life. In 2012, it's estimated that half of physicians were employed. There's been a migration of physicians to regulated entities to allow cost containment and ostensibly to increase quality. This newly employed status, however, provides physicians with the potential right to collective bargaining. Why unionize? Most polled unionized physicians don't see themselves as radicals trying to change the system, but rather as conservatives seeking to preserve medical professionalism. Physicians want to preserve their right to practice medicine according to their own professional judgment for the advantage of themselves and their patients. They want to ensure an ability to set fees, work rules, and other regulations to assure the proper care of patients. And there is significantly fear of legislation that would allow insurers to decide which services could be provided to patients. In the 1970s, about 30 unions emerged. Only a few, however, survived, including the UAPD on the West Coast, the Doctors' Council on the East Coast, and later, the Committee of Interns and Residents. In 1999, the AMA began the Physicians for Responsible Negotiation arm, which was designed to help physician negotiation. It was defunded in 2004, however, with limited success. Why do unions in the U.S. fail? Unionization is considered to be inconsistent with medical professionalism by many physicians, and the ultimate bargaining tool, the strike, is unpalatable to most physicians. Strikes are rare in the U.S. This is a notable example of a successful strike in San Francisco, which virtually eliminated elective surgery in the Bay Area with significant consequences. Doctors in most industrialized countries do actually bargain collectively, and there have been more than 30 strikes documented internationally. The pattern of success of these strikes is public support, and without it, doctor strikes generally don't succeed. The FTC treats private practice physicians as independent contractors operating small businesses based on a landmark case based on the International Union of Horseshoers. Only employees may bargain collectively. Independent contractors may not, which is considered price fixing, which is apparently only legal if you're the federal government. IRS Code 501c6 tells us that professional associations may engage in political activities, but cannot bargain collectively. The NLRB has ruled that physicians employed by a hospital can actually join a union and bargain collectively, but there's a catch. Physicians or nurses in leadership roles like medical directors, charge nurses, supervisors may not engage in collective bargaining, as such action is contrary to the interest of the employer. So will physicians in the U.S. unionize? Really, physicians in the U.S. have not taken much interest in collective stance, and many have been slow to take action to challenge their new working conditions. The most notable action has actually been joining into larger practice groups with identifying shared interests across specialties. As more physicians become employed, as autonomy decreases, as conditions potentially worsen, and as governments and corporations take more control, unionization may in fact be inevitable. Thank you.